Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Fajar Raharjo. My number student 007. I'm from international class. I will do presentation about Asperger syndrome. Okay, stay tuned.
Assalamualaikum warahmatullahi wabarakatuh. I will do presentation about Asperger syndrome. What is Asperger syndrome? This is definition of Asperger syndrome. Asperger syndrome is a neurological disorder that belongs to the autism spectrum disorder. Autism spectrum disorder, or better known as autism, is a disorder of the nervous system that affects a person's ability to communicate and interact with other people. Asperger syndrome is slightly different from other autism spectrum disorder, such as autistic disorder. In patients with autistic disorder, there is a decline in intelligence or cognitive and language acquisition, whereas in Asperger syndrome sufferers, they are intelligent and proficient in language, but appear awkward when communicating or interacting with the people around them. Next, this is sign and symptom of Asperger syndrome. Number 1. Difficult to interact. People with Asperger syndrome experience awkwardness in social interaction, both with family and other people. Number 2. Not expressive. People with Asperger syndrome rarely display facial expression or body movement that are associated with expressing their emotion. When happy, people with Asperger syndrome will find it difficult to smile or not be able to laugh, even though they receive a funny joke. Number 3. Not sensitive. When interacting with other people, a person with Asperger syndrome can spend hours discussing his favorite hobby. For example, talking about clubs, football, or player football. Next. Number 4. Less increased change. Routinely doing the same thing over and over again or repetitively and not accepting change in the environment is a characteristic of people with Asperger syndrome. For example, like to eat the same type of food for some time. Number 5. Motoric problems. Children who suffer from Asperger syndrome experience delays in motor development when compared to children their age. For example, they often seem to have difficulty doing normal activities such as riding a bicycle. Number 6. Impaired physical or coordination. The physical condition of people with Asperger syndrome is weak. One, the sign is that the patient gait tends to be stiff and easy to sway. Next, this is causes of Asperger syndrome. Number 1, infection during pregnancy. Number 2, exposure to agent or factor that cause deformities in the fetus. In 1990, the thimerosal content in several vaccines was suspected to cause Asperger syndrome until almost all vaccines were produced without the chemical substance. However, in 2004, this allegation was broken because thimerosal was not proven to cause autism in children. This also reinforced by the continuing increase in the number of people with autism after thimerosal was not longer used in vaccine manufacturing. This is treatment of Asperger syndrome. Number 1. Language, speech, and socialization therapy. This therapy tries to get sufferers to talk to other people, make eye to contact when interacting, and discuss topics that are also desired by the other person. Number 2. Physical therapy. A number of routine exercises that can be applied are running, jumping, going up and down stairs, or cycling. Number 3. Occupational therapy. A fairly complete therapy by combining physical, cognitive, and sensory exercise. Number 4. Cognitive behavioral therapy. Cognitive behavioral therapy teach children about ways to express their feelings and get along with their peers or the people around them. Next, is Asperger syndrome can be cured? Yes, children with Asperger syndrome can recover and live like normal children, apart from undergoing several types of therapy, such as speech therapy, physical therapy, occupational therapy, and cognitive behavioral therapy. Not to forget, they also need to intake of certain drugs or medicine. Prevalence of Asperger syndrome. Asperger syndrome is often diagnosed after a child is more than 3 years old or school age. The prevalence of Asperger syndrome worldwide ranges from 3 per 1,000 children to 2.5 per 10,000 children to 1 per 100,000 children. Asperger syndrome is more frequent in boys than girls with a ratio of 4:9, 1.7:9. In Indonesia, there is no definite data from Dito Anurogo et al. 2017. I think enough from presentation from me. Thanks for your attention. You can ask the question in below or the commenter